Okay, so the Borough of Highland Park began the HP COPE program, and COPE stands for Civilian Outreach Program Exercise. What is COPE and how was it established? March 9th, 2020, Governor Murphy signed Executive Order 103, declaring a statewide health emergency related to the COVID-19 virus. During this, the declaration empowered the Office of Emergency Management at the municipal level to direct operational management of the declarations made by the governor. Highland Park Mayor Gail Brill-Mittler and the Highland Park Office of Emergency Management activated the local Emergency Operations Center, convened the Highland Park Emergency Management Task Force and the CERT team to activate the local emergency operation plan and coordinate planning, prevention, and response protocols for the Highland Park Department of Community Services. A series of strategies were utilized to combat the spread of COVID-19 and prevent its rapid spread in the population. Okay, what is COPE and how is it established? Sheltering in place became an active measure utilized by the state, and more drastic restrictions, such as geographic quarantining, were implemented by state and federal government. Individuals that could have come in contact with the virus or exhibited symptoms were being subjected to voluntary or mandatory quarantine. Such quarantines and shelter-in-place directives created many challenges for the municipality and the residents of Highland Park. What is COPE and how is it established? In particular, residents who are elderly, disabled, having pre-existing medical conditions, unable to leave their homes for any other reason, or who were simply fearful of being contaminated by the virus became isolated if family and friends were not providing assistance. Local emergency first responders anticipated to be overwhelmed with day-to-day operations and emergency calls, which would inhibit their ability to provide support and provisions to those in need or those who are isolated from daily interaction. The Office of Emergency Management, in cooperation with the Mayor's Office, needed to implement a plan to address these needs.
Okay. Our Highland Park COPE mission statement. Highland Park will develop and implement a plan to provide outreach and assistance to its residents in the following instances: individuals who self-quarantine, individuals under mandatory quarantine, multifamily residence quarantine, senior citizen residents who may be isolated from assistance or daily contact, disabled residents who may be isolated from assistance or daily contact, and individuals who may live alone. The concept of coordinating a volunteer effort came from many calls made to the Mayor's Office from residents wanting to volunteer to help fellow neighbors during the pandemic. These calls came in from individual residents as well as many houses of worship within our borough. The Mayor's Office coordinated to have the Office of Emergency Management and Department of Community Services, which is Andrea and I, launch COPE and utilize the Highland Park CERT team, who was already trained to coordinate its staff and additional community volunteers to address the needs of residents who are most vulnerable during the state of emergency. The Mayor's Office launched a community-wide notice to announce the existence of COPE and began to develop a working list of residents who needed assistance. In addition, notices were sent to the municipal houses of worship to assist with us in identifying those who may be in need of assistance. What support services did COPE intend to provide? Daily or regular well calls via phone or internet, delivery of food, prescriptions, and other essential items while avoiding person-to-person contact, telephone and internet conversations to promote social interaction, arranging transport to medical appointments via community MCOT, local EMS, or taxi if operable. Those who also needed transportation who were quarantined needed to make arrangements through the Highland Park Police Department OEM liaisons.
What was, you want to go?
We apologize, we're a little off kilter because we can't manage our slides. When deliveries needed to be made to a residence, those deliveries were done to the exterior part of the home only by a CERT team member wearing appropriate personal protective equipment. When a delivery needed to be made to the interior of a residence in the event the resident was physically unable to go outside, the CERT team coordinated with the Office of Emergency Management and the Highland Park Fire Department so that a more protective level of PPE was worn, such as SCBA, breathing apparatus, gloves, gowns, and a Tyvek suit. How did we promote this new program during COVID-19 pandemic? We've attached a postcard that was mailed to every resident of our borough via US mail. And it will just explain what the program was about, how to contact us, etc. The email was designated to be forwarded any request of assistance to our office. So emails, phone calls, everything was directed directly to our office. And our borough library, our public schools, our department, other services through in the borough, we used our email lists and social media channels to get this word out.
Okay, so now the postcard letters, as well as all the emails, that really informed people of the COPE program, both people who needed assistance as well as attracting volunteers. I don't know. Okay, so COPE program logistics. Highland Park OEM, Department of Community Services, CERT team, and COPE coordinators constantly communicated via conference calls multiple times a day to plan the logistics as calls and emails were coming in. And I just want to let you know, since we were working half the time in the office and half the time remotely, when a call or an email came in, it would be forwarded to the both of us, so then we could direct it to the proper entity. Working documents were created and made accessible to community services staff, CERT team members, and the COPE coordinators, where the request from the residents was input, and that's when they would be assigned a personal shopper, a well caller, or whatever the requested service was. We did find it very helpful to have the spreadsheets and to be able to share them, so that whomever received the call, everybody knew it was on the same page. And then we would know once the volunteer, or once the
shopping buddy was assigned,
yes,
we would know that they were contacted by a COPE volunteer, what the items that they needed or the services that they needed. And it was just a constant work document that was accessible to us, so we could kind of, as Andrea mentioned, be on the same page with everyone.
Yeah, we would know like when people were served, so we could make sure. Okay, a review of volunteer and assistance. Over 75 residents had reached out to offer services such as shopping buddies, well callers, or delivery volunteers. The COPE volunteers also took on 20 Middlesex County Meals on Wheels deliveries in Highland Park due to those services being suspended during the pandemic. I believe they lost their drivers for whatever reason, so the CERT team, COPE team members took that on. Additional requests from the Highland Park School District were made for COPE volunteers to assist in delivering food to the homes of students in need. Deliveries were facilitated to residents who were unable to attend the biweekly community food pantry distributions. So in all account, the schools continued to do for their free reduced lunch children. They continued to distribute food. Some people were not able to go to they had 2 locations set up.
And as well as the food pantry, we'll mention a little bit later in the slides, we have distributions every second and fourth Thursday, and then the following Saturday of each week. We do 3 distributions, and the COPE team was very beneficial with helping us get those for residents that couldn't come to distributions for whatever the reason. We would make deliveries directly to the person. The COPE volunteers, they received a thorough online training from OEM and CERT on how to stay safe and healthy while performing these essential services for their neighbors. Training included standard operation procedure and proper use of PPE. All volunteers had ample PPE available to them for them to use during the deliveries to ensure contamination risk was eliminated. OEM and COPE managers developed procedures to oversee COPE's signature Shopping Buddies program. Shopping Buddies were contacted by a volunteer manager, given the name, address, and contact information from a COPE client. The Shopping Buddy was then responsible for contacting the client, getting their shopping list, and going to the store for them. Shopping Buddies needed to stop at our local Stop and Shop in Highland Park, where our borough has an account. This prevented the Shopping Buddy from having to make an initial outlay of money for purchases, for purchasing the client's items, as well as having a cashless transaction. During the initial screening with each person that came in, they came directly to our department. COPE clients were informed that they would be responsible for paying for their purchases. If a client was unable to pay, then it would be referred to the Highland Park Food Pantry via our department, which we were very involved in. And we received many residents where we were able to get them connected with our food pantry, getting them food. So it was very helpful. We all kind of worked hand in hand with that. The borough also collected monetary donations to cover the cost of the items that were not kept in stock by our food pantry, but deemed essential on a case-by-case basis by the borough.
The precision in which this program had been executed can be attributed to the time and dedication of the Department of Community Services staff and to CERT leadership's commitment to its success. As additional client needs occurred, COPE volunteers were prepared to step up to the challenge to meet them.
Over the course of the last 3 months of the pandemic, the COPE program provided essential services to over 50 Highland Park residents on a weekly basis. And as we mentioned earlier, the Highland Park Food Pantry distributions were held on the second and fourth Thursdays of each month from 9 a.m. to 10:45 a.m. and 6 p.m. to 7 p.m., as well as Saturdays following those Thursdays from 9:30 a.m. to 10:30 a.m. in the parking lot of our community center, with the help of our Department of Public Works and also our Highland Park Police Department. During COVID-19, Highland Park Community Food Pantry served, you'll see down below, in March, 300 adults, 46 children, and 215 families. In April, 334 adults, 40 children, 260 families, and in May, 294 adults, 20 children, and 229 families.
The successful implementation and execution of the COPE program during a health pandemic was due to multi-agency and department communication and cooperation to ensure that the residents of Highland Park were supported during a stressful time in our country. The entire operation, which was forged together with everyone involved, due to the guidance of Mayor Gail Brill-Mettler, Highland Park's Office of Emergency Management Coordinator H. James Polos, CERT Team Leader Nancy Wolf, COPE Coordinator Dr. Alyssa Kaplan, hardworking and dedicated residents who volunteered, and the staff of the Department of Community Services. And we are happy to answer any questions that you have following the presentation.
And again, we very much apologize for not being able to handle the slides. Thank you so much, Christine.
Thank you, Christine.
Oh, no problem, no problem. Something we're all getting used to. So I am now going to unmute
now we can share the screen. It's down the bottom.
Oh. I'm going to unmute every one of our guests. So we'll have a Brady Bunch like screen. If you have a question, please feel free to ask. I see, let's see. Okay, let's see the questions. Okay, so does anyone have any questions? Hello?
Yeah.
Oh,
Hi.
I see one hand go up, two hands go up. Okay. Roberta.
Yeah, well, first of all, Highland Park, what a great job. Really unbelievable. How long did it take you to actually put it together? I mean, was it something like you kind of had planned, or you just said, we got to do this?
So within the first week or two, we were able to initiate this very quickly. It took many Zoom conversations, many calls throughout the day to kind of try to get this up and running. But we're happy to report that right away we were able to kind of get this in motion. And obviously, as things came out, we had more volunteers that wanted to help out, and yeah, just kind of right from the beginning.
We were a bit under fire because the postcards went out when the idea came, and then all of a sudden we're like implementing very quickly. But that's, the way it goes sometimes.
I mean, I think it was phenomenal because in a lot of municipalities, there would be the angst of, could we do this? What are the liabilities? How is it going to unfold? Unbelievable. But I had another question. You said that you screened your clients. Did you screen the volunteers in any way? What were your possible concerns about safety and security of your clients and volunteers that they may not have known?
So obviously everyone was kind of, as a client called, or even a family member of a client that might have lived out of the state looking to have assistance, or everybody kind of knew that it would be on a volunteer basis. CERT and OEM really took that part on, and they might have even more specific details in terms of their screening. That was something, since they have expertise in that area, that's kind of, they were in charge of the volunteers as we were in charge of the people that were reaching out and asking for assistance.
And really, it was a contact list. So it was basically, they were talking to them on the phone, getting their list, going to the store shopping, and then just dropping it at the person's home. So they're really, nobody should have been going into somebody's home or anything with the client.
And when that was needed, that's when that would be handled by the actual CERT volunteers and, our fire department, our police department.
Okay, thank you.
Talking about PPE, Donna has asked a question. How was Highland Park able to obtain the necessary PPE to roll out the wonderful program?
Well, we have H. James Polos, and he has worked with OEM for a very long time. So he was like right on the ball and right on, getting our task force together immediately. We need to order this, we need to order that. There was some things on hand, but immediately all the departments were asked to order masks and gloves, and everybody was always making sure that everybody had enough stock.
Impressive. Really a community-wide effort. We have one more question. Bill from KMM. Bill, can you hear us?
A great job again from everybody, all the presenters. I really appreciate the work you guys are doing. I guess I look at it from municipal level. Highland Park is a smaller town, and you did a great job. A bigger municipality will have to incur even greater costs. So there's parts of a budget that has to be considered. The mailing of the postcards, the overtime for anybody who's working on those weekends. Was that all absorbed by the municipality, or was there other contributions that come in from other places, a grant or any type of other thing to incur to be able to handle the costs associated with the program?
So first of all, our community food pantry received an overwhelming amount of support from our residents. And that really took up a lot of the big cost of people that weren't able to actually buy their essentials. There was many donations that came in for COPE as well, that was designed specifically for, again, how did I say it? The basis by basis of if it was
Like the essentials
the
for people who weren't
essentials.
able to actually pay for their receipts.
Yeah.
Our salaries, we are normally doing other things that had to be canceled, of course. So we were kind of reallocated. I do believe also there is money coming from the CARES program or the CARES Act that will also take care of other costs. But there were so many volunteers. I don't believe that this was a high cost program, in the end.
Mhm.
And we didn't have overtime or anything. We would just come in and do what needed to be done.
And as just a quick follow-up, make sure everybody else in the county at least know about what you're doing, and that the other towns have an opportunity to copy what you've done, because it's a great program. And want to make sure, now that things are settling down a little bit, try and get the word out beyond what KMM can do to help you. But I think it's a great program.
Thank you.
Thank you.
I have a question. You had mentioned that the shoppers would go to Stop and Shop to handle the shopping. Was that something that you had arranged prior to the pandemic? Is that or was that something that you had to do on the fly?
So we have an account with Stop and Shop for our community center in general, when we have summer camps, when we have different programs. So we have different borough accounts already set up, and that was very helpful to have initially. There is there's obviously policies and procedures where there's a minimum amount to purchase. So Stop and Shop was helpful in allowing us to maybe go under our minimum in the event people, had under that they needed. But Stop and Shop was very helpful and accommodating. And, then we kind of took on the back portion of it with getting the receipts paid and getting Stop and Shop paid. And, as people's checks were coming in, and Andrea can also speak about my rec.
So a couple of more points with this program. When the shoppers would purchase, the shoppers would be on a list for Stop and Shop. So we would continually update our list with the corporate office of Stop and Shop, so they would be allowed to sign to purchase the food. They would then scan the receipts and get them into us, so that we knew what to pay. So then we would put all of the receipts that would come in on a purchase requisition, and that would be paid by purchase order back to Stop and Shop. So it really was dependent on the volunteers immediately scanning those receipts to us, because we really shouldn't get behind. They would also, with the purchase, would give the client a receipt. So then the client would know how much their groceries were and how the procedures to pay. There were a few different ways that they could pay for this. They could send a check to our building, which we had an outdoor mailbox installed. So they would either pay for their groceries by check, or they could go in to, we have recreation software. They could make a household account, and then they could pay by credit card their specific purchases.
Have a good day. Yes.
So,
You're welcome.
You guys are busy.
And this system, obviously, that portion initially through this had a few hiccups.
it evolved over time. So
but-
it's not like we were doing this immediately. We kind of were figuring it out as we went along.
And some people, obviously, they got that postcard and thought, okay, well, I can have whatever I want. And it wasn't like that. It's meant for essentials. And sure, if you have a specific, if you have dietary restrictions or you need something specific, obviously that got accommodated. But it wasn't kind of like you can go.
Not surf and turf.
We also wanted to limit the exposure of the shopper also.
Right.
So we just kind of tried to make it fair for everybody.
I think just one of the things that's so interesting about your program is that the postcard not only asked for people who needed help, but also for people who wanted to help. And so you were talking both sides of the equation, because I think for many people in the early days of the pandemic, it's like, what can I do?
Yeah.
And so you answered both parts in your initial outreach, which I would think is really smart in terms of putting people to work who wanted to do something, as opposed to people who needed stuff,
Right.
only being the focus of the communication. Neat.
And there was
Very-
an outpouring of people
was.
volunteering. So more
So
people
many.
volunteered than we even needed.
Yes.
So it was
And
very
we made
positive.
sure when they reached out that we obviously, expressed our gratitude that they wanted to help.
Right.
I think that they wanted the well calls to be a little bit more than they were, but luckily our town, us as a community center kept in touch with our members, our houses of worship kept in touch with their membership,
Right.
and we just made sure everybody had constant contact, that everybody knew that we were always here and available.
Mhm.
And as Andrea mentioned earlier, as a call or email came in, we would get it directly right then, and we would just call the resident right away. So they weren't waiting. So
Excellent.
that was important.
That's amazing. We have a question from Linda.
Hi, guys. You all did a wonderful job. Really nice to see this collaborative effort. My question's for Karen. How are you managing remote travel training during this very unusual time? And what are your plans as we go forward in this next few weeks and in the month? How are you going to get back on the horse, if you will, for one-on-one or small group travel training?
Sure. Good questions, Linda. So in terms of remote travel training, we have 450 people who have graduated from our one-on-one travel training program that we do in partnership with Access Link. So and at the point the pandemic started, we had 20 people currently in our active queue that were somewhere in the process of getting travel training. So we took a step back and looked at the different skills that we teach, and then tried to figure out if there were ways that we could teach those virtually or remotely. And some of those we could. And we went to the folks that were currently in training and said, would you like to learn about trip planning? Would you like to practice your scanning the environment in terms of safely crossing a street using video? And some folks wanted to continue in terms of some specific skills, and we developed modules for that. And we contacted folks who had graduated from travel training in collaboration with our funder, New Jersey Transit, and said, is there another destination that you're interested in exploring, or that we can help you plan that trip? We also had a chance to talk with them about, are there any other needs or concerns that you have, so that they had somebody making contact with them. What we found in those follow-up calls is that not only were people continuing to use transit up to pre-pandemic, but some of them had destinations that were as far away as Connecticut, or they
Unusual.
wanted to know how to get to someplace in Pennsylvania. And
Yeah.
so we wouldn't normally have the time to help them plan those trips and think those through, but we did. So on a one-on-one basis, we really worked individually with customers based on their curiosity and inquiry. Some of them wanted to learn how to use the New Jersey Transit app, how to buy a ticket through the app. So all of that was stuff we could do virtually. And with some of our groups, we were able to continue doing group training. Again, practicing those skills, and in some cases doing short virtual visits to places like Rutgers, where we showed them some of the different highlights at Rutgers after explaining to them from their school how they could get to Rutgers using transit, and showing them all of the elements of that trip virtually using the New Jersey Transit website and other online tools. In terms of going back, because we are part of Rutgers University, we will be following the guidance from Rutgers. We will continue to be doing remote and virtual training with individuals to the degree that they are interested in continuing to do that as things open up. We will not be graduating anybody from travel training until we've had the opportunity to observe them in the field one-on-one. We can't say in good faith, yes, we know you can use the train if we haven't seen you use the train.
Yes,
can only-
I agree.
so-
That's a tricky one.
Yeah, that's a tricky one.
Yeah.
But the expectation is with this remote and virtual preparation, some of that in-field training will be quicker, because they'll have these base skills about buying a ticket and purchasing, planning a trip and navigating the website that we will have done with them virtually. So we've been very creative in terms of developing new material to deliver it this way. And, the hardest thing, Linda, I think for all of us is we don't know exactly when that reopening is going to be, again, because we'll be following the guidance from the state and from Rutgers as a university, since we're part of the university system.
Sure, sure. Okay, great. Thanks, Karen.
Sure.
I think, Roberta, do you have another question? I see your hand.
Sorry, no.
Or, no? Okay.
But I will just say, Karen, I thought your presentation, not unexpectedly, was outstanding. I mean,
you.
you're an expert in this field. What interests me is we know that seniors are such a large part of the population, and yet for some reason seniors haven't, to some degree, mobilized to demand better transportation services from their municipalities or from New Jersey Transit. But you think about the municipalities that offer shuttle services, but by and large, they stop at the border of the municipality.
Right, they're local.
And I think that's going to be a challenge going forward, to get municipalities to say, well, maybe the doctor's right over the municipal line, you know, can we take people there? But your presentation, I think, just hit home,
Thank you,
especially
Roberta.
the faceless days.
Yeah, that phrase, when I first heard it, really evoked something for me that was very clear. The other thing that I neglected to say in my presentation is I forwarded to Christina a list of virtual support groups that is current in New Jersey that was put together by another organization. One of them includes a boomer support group, but they're on a range of topics. And for those of you that are working with older adults or other people who are, it might be something useful to share with folks in terms of just having that social connectivity. I think the real lesson I'm taking away from this time, as someone who's thought about aging and mobility and independence for her whole career, is I've always assumed you had to get the person to the thing. And increasingly, I'm thinking about getting things to people and why people need to go to places. And sometimes it's because they need that connection with other people. It's not, I once saw my 85-year-old father-in-law spend half an hour at Trader Joe's, and he didn't buy anything. He just needed to walk around and be with people.
Yeah.
And I think we really don't understand how important that is, and that we can potentially do it virtually with the right training and the right supports that can help. It doesn't replace, but it can help.
Right. One last question for Kim and Andrea. Is your program still going on? Do you see it moving into the fall? What's the status?
So as of the 15th, it was put June 15th. It's put on hold. And the reason why is because it feels funny when we say this, but we're officially back on Monday, our staff and our borough. So we're able to take on all of the clients that are in need. Andrea and I have been, in the office pretty much every day through the pandemic, only because, we are overseeing the community food pantries and the distributions and the COPE program. And it's just, emergency meal preparations of people that were just calling, we were just always here. So, but since we have our staff back that can help with that, we're going to take that on. CERT does have a few of their volunteers that are going to be on hand to assist us with the deliveries and things of that nature.
I think also a lot of other things opened up.
Right.
Like they're able to get the like Peapod or a delivery service. Like through the pandemic, that was not available to people. So that was a big problem. And people are starting to feel a little bit more comfortable going out. So hopefully things will, that'll give them, an opportunity to be with other people as well.
Which is scary in its own right.
Exactly. Linda, I saw that you sent a link to seniors and millennials share movies virtually between Lake Park Center living in Missouri and New York. Linda provided a link from CBS News. It's
So
very
cool.
interesting.
I
will send
really
it to
encourage
everyone
you
as
all
well.
to take a look at it. Unbelievable how this one senior community was just, again, looking for different ways to find how to engage their seniors. And these millennials who had worked on a project years earlier in New York City, they kind of do, if you've ever seen like programs where you watch a show and there's other people commenting during it. So everybody watches the movie, and then at the end they all have a conversation about it, but it's done virtually. It's extraordinary. When you look at ways to engage seniors, and again, everybody kind of said the same thing. Seniors don't know if it exists if it isn't at their doorstep, period.
Right.
If there's not someone delivering them a package or giving them food or handing them their mail, or if there's not a vehicle that's showing up for them to take them to something that's so care critical, it doesn't exist for them. So this was extraordinary, I thought, in terms of interaction between anybody, but certainly between generations, for sure.
Right.
One of the things that I think was actually very interesting, and I'm not a social science researcher professionally, I sort of play one on TV, but I think when we reflect back on the pandemic and we look at older adults and their ability to connect to some of the technologies, I suspect that Passover and Easter falling early in the pandemic exposed a lot of older people to Zoom because they wanted to connect with families.
Right.
And it meant that whatever trepidation they might have had about trying it for the first time or whatever got trumped. And I think it'll be interesting. There may be other things like that, but because that was such an experience for so many people, a once a year kind of holiday coming up, and that there was a way to actually make it happen, even though it wasn't perfect, there was a way to make it happen. I think that really, a lot of things moved a lot more quickly than they might have because that hesitation just got rolled over.
And I think it's so extraordinary because we're basically talking about the last generation that doesn't have those skill sets.
Right.
Right.
Everyone,
I'll
younger
just
than
go in
70.
that I've gone from baby boomer to geezer zoomer. Okay, so it's not that hard of a trend.
Geezer Zoomer, is that what you said, Bill?
From baby boomer to geezer zoomer, right?
Love it. Love it.
As a senior.
Okay. I have to steal that too.
Thank you, Bill.
You can have it.
And I think one thing that is for certain along the lines of what, Karen and I had talked about this yesterday, in the months to come, I think there's a very good opportunity to use high school students, college students that are looking to volunteer and sit down with seniors and boomers and teach them how to use the technology that's out there so that they're not so intimidated. I know that, my mom went from using her cell phone strictly as a phone. Meanwhile, we kept telling her she has a computer in her hand and she just couldn't get it. And then all of a sudden she knew how to FaceTime us, and she was FaceTiming us all the time. So, and she was on Facebook and she was friending and liking everything in sight. And that was her only source of connectivity because she lives alone. So in the coming weeks, there could be a potential for a wonderful program that maybe the communities in Middlesex County can have their younger generations teach the older generations how to use the technology in an effective and great way. Do we have any more questions? I see, Bill, you have your hand raised.
That was a long time ago.
A long time ago. You still have that question, or?
No.
Okay.
No.
Okay, so we're going to wrap up the call. It has been recorded, so everyone will receive a copy of the recording probably early next week. You'll also receive the presentations, the link that Linda had discussed, and also Karen as well. And if there are no more questions, we are going to wrap this up.
Thank
Thank
you
you
all.
for inviting
Thank
us.
you very much.
Thank you so much. Thank you, Kim and Andrea and Karen. This has been wonderful. We really appreciate it. Have a great day, everyone. Stay safe, and see you soon.
Yeah.
Bye.
Bye.
Bye. Bye.